Another area that is actually important. I remember we had one case of a patient being referred from an outer dentist. The patient was carrying his X-ray film with him, and he was a bit worried. He said that the doctor told him that in the X-ray he showed area similar to this one. He told him that you have a very big radiolucency that has destroyed most of the maxilla. And then when we examined, it was simply the maxillary sinus. Actually, I feel a bit, I don't know, worried if a graduate dentist cannot differentiate between an important anatomical landmark like the maxillary sinus and a big pathologic lesions. And this is why we should always insist on the importance of radiographic anatomy, anatomical landmarks that should be studied and very well mastered, so that we don't mix with disease. Anyways, the maxillary sinus is located usually. The maxillary sinus is one of, as you know, paranasal sinuses, and the maxillary sinus in particular has a special relationship with the upper posterior teeth. The floor of the maxillary sinus would appear normally as a continuous thin radio-opaque line that extends. The extension varies. Sometimes it goes to the level of the canine, sometimes it is located just posterior to the 5, sometimes it is V-shaped, sometimes it is scalloped, it goes up and down in between the roots of the teeth. The level also differs. Sometimes the level goes well above the apices of the posterior teeth. Sometimes it extends down. Of course, it casts a shadow on the teeth, and then it goes down, especially in cases of pneumatized maxillary sinus. In all cases, and of course, it's not always necessary that the right and the maxillary sinuses should be equal in size and shape. They differ. The sinus sometimes might be unilateral, single cavity, and in other instances there you might find a septa in between. So we now know that the maxillary sinus differs in shape, differs in position, and differs in size, and as well as its location. So see, this case, for instance, the maxillary sinus is just distal to the 5. This is the floor of the maxillary sinus. It has nothing to do with the canine, nothing to do with the premolars, but it is very well located beyond distal to the 5. If we go to the previous slide, see, the maxillary sinus is seldom seen completely radiolucent. Ideally, it's an air-filled cavity, but it should, in radiology, it should appear as a completely radiolucent, but it never appears actually radiolucent, because there is the superimposition of structures. You see that when you take an X-ray for the sinus, there is the superimposition of the soft tissues, the teeth, the bone, and there is the meatus, the inferior concha, which spreads over the medial wall of the sinus. Again, it will cast a shadow. So in this case, it doesn't appear radiolucent. It's always grayish in appearance. However, you see that an important appearance in the maxillary sinus is that there is no bone trabeculation. Compare between the radiolucency of the sinus all over here and the maxilla. See the bone trabecules, typical bone trabeculation of the bone. Again, here you don't see it completely radiolucent, but you would see it as a grayish in appearance. You see this line over here? There is a difference in contrast between this area and the one over here. This one appears more radio-opaque. Actually, this is the cast of the naso-labial fold. Naso-labial fold, it will cast its shadow on the on this area, and thus it will appear more radio-opaque. If you go back to the previous slide, you will find it here, this one. See this line? Compare between this shadow over here, the area, the radio opacity, and the one here, this triangle. This appears more radiolucent. This line actually demarcates this one, the naso-labial fold. Again, it will cast its shadow, so we should take care of this appearance. Here it's more clear. This one. Okay. And this is the extension of the naso-labial fold. Of course, it extends down, but what is important to us is that it's cast being or the shadow being laid on the image. Another radiograph which shows clearly the naso-labial fold, this line over here. This one. See, this is soft tissue, of course, of the cheek, because the cheek becomes thicker here, and this one has a reduced thickness, so it allows more X-ray to pass, thus it will appear more radiolucent. Compare it to this one. This is again the line which is demarcating the naso-labial fold. A question that is often asked by too many dentists is the question, is the root of the tooth, especially the premolar tooth, inside the maxillary sinus or not? Well, ideally, let me put it this way. If this is the maxillary sinus, okay, this is the image of the maxillary sinus, and this is the image of the tooth over here. Okay, what happens is that the image of the tooth, the root of the tooth, it appears as if it is inside the maxillary sinus, right? When you take an X-ray, it appears as if the root of the tooth is exactly inside the maxillary sinus, but in reality, this is the relationship. Okay, I'm looking for, see, this is the shadow, and this is the reality. This is the problem with 2D imaging, is that you have you lose depth. So how do you know that this root is inside the sinus or not? From two things. One, you follow the line of the floor of the maxillary sinus. It should be continuous, especially at the junction of the root and the floor of the sinus. Second thing, you follow the PDL, not the diamina dura, the PDL. The PDL of the tooth should be continuous from the alveolar crest upwards. See, this radiolucent line surrounding the root. If the PDL discontinues at the junction of the root and the floor of the sinus, then it means that the root is inside the sinus, which is the exception, not the rule. It is the exception, not the rule. Another radiograph showing the floor of the maxillary sinus, which is now located very high. I'll go a bit slowly over here. The floor of the sinus, see it is located above the almost apical to the. This is the mesiobuccal root, and this is the distal-buccal root of the first molar. Bone trabecules and bone marrow spaces, again, as we always say, in the mandible they would appear as in the maxilla they would appear lace-like, and they don't have a specific orientation. Excuse me, and with large marrow spaces. Another review of the floor of the sinus. See the floor of the sinus here. This is the floor of the sinus. This is the radio-opaque line. Concentrate on this area. Continuous. See this line? It's continuous. It goes up, and then we lose the track. We don't know how far it goes because the wisdom tooth is superimposed on the image. What you do here again, this is the maxillary sinus. All this radiolucency is the maxillary sinus, and if you want to know if the root is inside the sinus or not, as we agreed, 1, I follow the floor of the sinus, it is continuous. 2, I would follow the PDL. If the PDL is continuous all around the root, it means that the root is superimposed, this relationship, superimposed on the sinus, and the real relationship is this one. This is the sinus, and this is the apex of the tooth. Okay? So, as we said, that the maxillary sinus differs in its extension, differs in its size and the location. And this is what I was talking about: the mesiobuccal root and the palatal root and the distal-buccal root. What we do is that we follow the PDL, not the lamina dura, because the lamina dura tends to disappear by exposure factor or by superimposition of structures or by disease. But the PDL does not, especially if there is no periapical lesion that would affect the tooth and cause the expansion of the PDL. Another review where you can see that the sinus extends from, this is the level, see? And can you see this area? This is a septum. Septum inside the sinus. However, it doesn't go all the way upwards, so sometimes it's short, and then the sinus continues backwards. And there are many studies on classification of the septi of the maxillary sinus, and you can see here sinus and the roots. These are scratches, as we said earlier, caused by the overuse and scratches of the PSP plates. So this, if you have scratches like these, don't continue working on this plate, because it will block some of the important areas on the on your radiograph. Now, I want you to concentrate on this U-shaped radio opacity. U-shaped radio opacity, which you always see, especially when in the X-rays of the upper molars. This one. This is actually the zygomatic process of the maxilla. Zygomatic process of the maxilla. It is not the maxilla. It's not the zygomatic arch. This is the zygomatic process of the maxilla, which is located exactly over the molar tooth. When you take an X-ray, the image of the zygomatic process of the maxilla, it will cast a shadow on the apex. Of course, it differs on the angulation. Now, if you come from top and you increase the angulation, the zygomatic process of the maxilla will go down, and vice versa. If you decrease your vertical angulation, the image will be moved upwards. So the zygomatic process of the maxilla is a U-shaped or J-shaped, sometimes radio opacity, located above the molar teeth, and while the posterior extension, the posterior, which is marked here in blue, the posterior extension of the zygomatic process of the maxilla is the zygomatic arch. This is the zygomatic arch, while this is the zygomatic process of the maxilla. So please, there is a difference. The zygomatic arch is a posterior extension of the zygomatic process of the maxilla, but what really appears on the radiographs is the zygomatic process of the maxilla. And this is, as I said earlier, this is a septa inside the maxillary sinus. Palatal root of the upper 7, and the mesiobuccal root of the tooth, this tooth, and this is the distobuccal root of the tooth. So this is the root over here, 1, palatal, and this is the distobuccal. These teeth are not inside the maxillary sinus actually. As I said, they are superimposed on it. And this is the distobuccal root of the 6 over here. You can follow it from the PDL, and you can see that the mesiobuccal root of the 6 is a bit dilacerated distally, as you can see here in this radiograph.